In our study on artificial intelligence, robotics, and 3D printing, and its potential impact on Canadian healthcare systems, I can tell you that the leading researchers, Canadian researchers that appeared before us, all had the equity issue as an ethical equity issues as a primary kind of concern. And what we saw this morning was the advances in AI that will move beyond limiting recognition factors to certain ethnic groups and so on, to broaden it out, to recognize all. If the Chinese can recognize every individual out of 1.4 billion people with the current technologies, immediately a major ethical issue of eliminating, not incorporating, many human structures is already being solved. So one of the great potentials of the current advances is to be able to remove the barriers from ethical, equitable treatment of our citizens.
Let me ask you, is it equitable to do a second CT scan when someone comes into emergency because our EMR system doesn't chat with the hospital that's on the other side of the city? Is it equitable to potentially have a drug reaction because, again, we don't have access to that patient's past medical information? And so that's why I do think equity is kind of built into many of these exponential technologies. We do have to design for and be careful about the inequalities that we do see in our society. And we can't be naive to that, but I'm amazed at the number of social impact-oriented entrepreneurs that are out there, and I'm hopeful that this generation will show the previous generations what it's like to be a benefit, focus on the social impact as much as it is the profit.
When I meet the young entrepreneurs, whether these are docpreneurs like Phil that are kind of still doing their clinical practice in the 19th century and trying to create the 21st century, they're in it for their mission, right? It's a calling. This is not a business. So these young entrepreneurs who have chosen not to have what could be probably a straightforward path in life, have chosen to be health entrepreneurs, they are thinking about equity front and center. Everybody. I don't know anyone that thinks they're going to make $1 million off of healthcare innovation. So it actually gets me more excited that the new generation of problem solvers are actually solving for why we're all in healthcare, which is the calling of health.